I'm going to present you what we believe is the first evidence of a drastic and sustained reduction of essential tremor with very low energy transcranial focused ultrasound neurostimulation. You will see that we will report up to 98% tremor reduction for more than 25 minutes on patients that were suffering from essential tremor. So the main question, the burning question now is how to induce a strong target engagement with transcranial ultrasound stimulation. First challenge is actually to be able to reach the target in humans, despite the defocusing effect of the skull bone. And the second challenge, of course, is to induce a response in the brain with pulse stimulation. To address the first challenge, the best way to refocus the beam through the skull is to use multi-element transducers. At least this is the only available way here currently to be used in clinics. And it is possible to use 1028 element transducers for which you adjust actually the phase in order to refocus the beam through the skull quite precisely. And we took advantage of the precision of the Exablate Neuro system, and we tested neuromodulation sequences on patients that were recruited in a clinical trial to be treated for essential tremor, and for which we would test low power sonication. So of course, this is the results with high power sonications. This is something that you are all familiar with now. By inducing a lesion in the VIM, it is possible to decrease significantly the tremor on those patients and treat those patients. What we did actually is that we tried to assess the tremor quantitatively during the treatment. What we did is that actually when starting the sonication with the Insightec machine, the neurologist is asking the patient to hold a posture within the MR so that we would record the tremor by attaching accelerometers on each of the patient's hand and recording the data of the accelerometer. If you wish to have more details about the MR compatible accelerometer setup that we use, I encourage you to go and see this other presentation that we gave at the symposium. Typically, this is the effect of the high intensity focused ultrasound sonications that we achieved. You see here between the beginning of the sonication and the end of the sonication, we see that the tremor power that we calculate with the accelerometer decreased significantly. And this is due to a thermal effect. Here we induced a transient effect with a 51-degree temperature elevation. It's transient because a few minutes later, you see that when we start next sonication, the tremor is almost back to its initial value, slightly lower. Then we increase the temperature up to 59 degrees, and you see again a drastic reduction this time, 90% reduction typically. And this time, even though we sonicate again to consolidate the effect, the tremor is not back anymore, and the patient was treated. But this is with high power, typically 500 to 1000 watts. What we did actually is that before entering the treatment part of the protocol, at the beginning of the protocol, we used the precise targeting of the Exablate Neuro in order to stimulate the brain with low power ultrasound. The parameters that we used with those very low power ultrasound are based on the literature actually, and mostly from Sunchikyo's group and this publication in which they reported effects on rabbits. They use typically tone burst durations that were varying between 0.05 milliseconds to 50 milliseconds. And they used also, they varied the repetition time between 100 milliseconds and 1 millisecond. The total duration of the sonication was up to 2 seconds. And they could achieve here a transient effect on those rabbits. We based our protocol also on previous work from our group, inducing not only transient effect, but more long-lasting effect on primates. And actually to do so, instead of sonicating for 2 seconds, we sonicated for a longer duration with a 30 millisecond on, 70 milliseconds off, so pulsed, but for 20 seconds. When translating to this clinical trial, we used the tone burst duration and repetition times that varied within the range of Sunchikyo's paper. for a total duration of 5 seconds. And we repeated those sonications here every 15 seconds. So the total duration here was a 45-second sonication with actually pulsed sonication lasting for 5 seconds each, and we did it 3 times. Those are the reference parameters. And we also targeted 2 actually targets. One was the PIM, one was the DRT. You can see here, closer view that those 2 targets that are really involved in essential tremor are both located in the ribothalamic tract here in white. They are both right at the border of the thalamus. They are typically 1.5 to 2 millimeters away, quite close to each other, but we wanted to test modulation on those 2 targets. So here are the effects of the neurostimulation with a quite low power, see less than 10 watts. So here, this was an example of a 10-watt sonication. And you see, actually, this was surprising to us because we see a decrease here in the tremor. And as I presented you before, we obtained also such a decrease with very high power sonication. But you see here with 10 watts, we can see actually a drop in the tremor. If we use another set of parameters with a lower power, actually we see an increase in the case of the tremor. It's not significant for another set of parameters depending on the duration and the pulse duration. And here again, for the last sonication, again, 10 watts, we see also a reduction in the tremor. So you see, depending on the stimulation that we use, we see actually this is neuromodulation. We modulate activity within the brain. And this was with PIM targeting. And then we moved to DRT targeting. So exactly the same sequence as the one that was used here in the VIM. So we moved only 1.5 millimeter away and same power. And actually, this is the result. And I displayed data. It's just that the decrease was so strong that you don't even see the tremor anymore here. If we zoom in, you will see that there is some residual tremor, but much less than before. Actually, it's a 99.9 reduction in tremor. This was mind-blowing to us. And the tremor was literally gone. And the patient thought that he was already treated with high power, which was absolutely not the case. This was just a reduction of the tremor due to very low power stimulation. And you see actually that the 90% decrease was sustained for actually more than 30 minutes. This is 30 minutes later. Here's another example on another patient. That's a thinner skull, so we used a lower power. And you see again, for the first sonications, we see some fluctuations in terms of tremor when we target the VIM. Once again, when we move to the DRT, you see here again with that same sequence that we used 2 millimeters away here on the DRT, we see a significant reduction. It does not see, it's not as dramatic as before, but actually look at the post effect here. You don't even see the effect. It's just that it took slightly longer to decrease the tremor, and here is a zoom here. So again, there is a slight residual tremor, but much lower, and we achieved 98% reduction for 30 minutes. And you see in the time course about all the first sonication, and suddenly here a very high decrease in tremor. But like this, we made a measurement every 5 minutes for 30 minutes, and we see a sustained reduction of the effect. So to conclude, we report here a strong motor response to non-thermal low power sonication in humans. We did not measure any thermal rise during those sonications. It was so low that it was below the noise of the MR measurements. And we achieved 98% tremor reduction for more than 25 minutes on 2 patients. We took advantage of the high precision of the Exablate Neuro to target both the VIT and VIM, even though they are very close to each other. If you have an Exablate Neuro, don't look for a neuromodulation mode. System was slightly modified for it, so that currently, to my knowledge, those sequences are only available at our Center of Excellence in Paris only so far. It might change in the future. I would like to thank our sponsors, the French National Agency for Research, the Fondation Bettencourt-Fuller, and the Focus Ultrasound Foundation for their support. This is the work in collaboration between Physics in Medicine in Paris and Brain Institute at the Pitié-Salpêtrière Hospital. Thank you for your attention.